we will talk about why AI is necessary and what are the foundations of AI, what are the applications of AI in health sector, specifically epidemic and pandemic crisis, how AI can help us to make decision-making, policies, planning, what are the challenges and limitations. I think this is one of the most important part of this presentation, to understand the current challenges and how we can proceed to circumvent their challenges and become the flag bearers of AI in health sector. And then we will conclude this presentation. All right. So let's start with why AI. Is AI a solution to every problem? If the answer to that question is no, then a simple question would be, then why do we need to use AI for health crisis? So AI is very important and indeed one of the best solutions for health crisis. So let's see why. So global health threats, I've just showed you a quotation from WHO, and you can see 200 million plus cases, 6.9 million plus deaths, 12 trillion loss to economy, and 90% of the healthcare system went through disruptive services. And this is a huge impact. One of the things that is very important to note is that whenever there is an pandemic and epidemic, not just the healthcare system goes through a turmoil. Rather, it shapes and reshapes the societies, and it has a significant impact on the economies of the world. So, and it's not just about the COVID-19. If we go through the Ebola outbreak that happened between 2014 to 16, it cuts West Africa's GDP by up to 12%. So these even shows that there is an urgent need for AI-driven decision systems. Now, if we understand that AI is the approach we should go for epidemic and pandemic crisis circumvent, then what is actually the problem with the traditional decision-making issues? So these 6 steps are the ones that help us to collect data, report to authorities, aggregate at national level, analyze that data, do decision-making based on data, and finally deploy the solutions and the decisions that we have taken. But throughout these whole 6 steps, the traditional approach creates lots of delays. And incomplete data hinders the response and timely communication to the public. And when there is no timely communication to the public, then inefficiencies lead to higher mortality rates. It has huge economic impacts and a weaker public trust. So step number 1 is manual data collection. So when we use the word manual, and if it is not digitized, that's where the problem begins, because often they are paper-based and it will get delayed, and making from manual to digitalization of that data also takes time. Then we have to report it to the authorities when you collect the data, so they can be delayed due to administrative loads or poor communication infrastructure. And step 3 is once you collect the data at the local community, at local level, then you need to aggregate it to the national level. And national level data might be incomplete, it might be inconsistent, or it can arrive at different times, which will create further delays. Anyhow, when the data is aggregated at the national level, then you need to analyze and interpret. So experts will review this data that has been collected. But the problem is, in such manual data collection and delayed reporting, there is no real-time modeling or predictive forecasting. And this is exactly where we need AI to solve this problem. Because if we go up to step number 4, then decision-making is uncertain at step number 5. And when decision-making is uncertain at step number 5, then, of course, the deployment of the decisions, the deployment of the health messages, vaccines, interventions, everything will be late, which will lead to inefficiencies. And inefficiency will lead to higher mortality rate, economic impact, and weaker public trust. So these are, in a nutshell, some of the problems with the traditional decision-making systems that don't involve AI to the extent that we wish to involve. So why AI is needed? First of all, I mentioned the word delay quite a lot in my last slide. So the answer is AI is provides speed. So the delays that we face in traditional decision-making system, AI is the answer to that. But the good thing about AI is it's not just fast. It's not just going to answer the delay question, but it is also got the predictive power. It has got the data-driven insight. So whether we talk about predictive modeling, where forecasting the outbreaks, their trajectories, how they're going to expand in a society, how the hotspot areas are going to be created. This predictive modeling is what AI provides. Then early warning systems, for example, Blue Dot is a very good example of those systems where it detected the Wuhan virus. I'm going to talk about this in the later slides when I'm going to talk about the case studies, actually earlier than when WHO alerted the whole wide world. And since it can do predictive modeling and early warning systems, so of course, decision support can be enabled by AI. The last point on this slide is actually very important. That is the scalability, because the epidemics, pandemics impact the whole wide world. The world is running on different systems, but we need to make sure that we can integrate all these systems, and these diverse data sets can actually help us to make holistic risk assessments. So scalability, in other words, is one of the most important things that can be provided by AI-powered solutions. So while we are discussing about AI, and we are going to discuss case studies and how it impacts the crisis management in healthcare system, let's do a little bit of foundations of AI. What is AI? What are the different types of algorithms and how it enables healthcare sector? So artificial intelligence, specifically in the domain of healthcare, is a computing system basically that help analyze complex data, which can assist in diagnosis, which can assist in decision making, and it can also help prediction. If AI is the bigger umbrella, then under this umbrella, we have two core branches. One is called the machine learning, and under machine learning, we have deep learning. You might have already heard these words. Deep learning is specifically very famous nowadays. Many applications are running on deep learning algorithms. So let's talk about these two core branches of AI one by one. So machine learning is a set of algorithms that will learn patterns from the data. So data is the one that we collect and feed it to our algorithms. And based on that data, some predictions will be made. And based on those predictions, decisions can be made. And one of the examples of machine learning is predicting hospital readmission risk from patients' records. So you have the patient record collected by the hospitals, you run a machine learning algorithm and train it so that you can predict what will be the readmission risks from the existing records. Let's talk about deep learning now. So deep learning is basically something that mimics our neural networks. Specifically very effective for large scale unstructured data. So images, text, signals can be analyzed by deep learning. So if you have chest x-rays and you want to interpret those chest x-rays to detect anomalies, or you want to detect anomalies in a function of the lungs, you want to detect anomalies in ECGs of the heart. So these are some of the applications of deep learning. So deep learning is much more complex as compared to machine learning. And complex, I say, in terms of computational power. So let's talk about the different types of AI models that machine learning and deep learning I've just discussed. So specifically in this slide, what we are going to talk about is that what these machine learning and deep learning algorithms that we have just discussed, what do they enable? How do they help? And what we can achieve from them? So you can see the 3 points that we can achieve, or 3 points where we can find the applications in healthcare systems. So predictive analytics, which is directly related to pandemic and epidemic crisis theme of today's lecture, diagnostic analytics and prescriptive analytics. So if you see, the machine learning and deep learning is actually providing us the data-driven insights by providing the analytics. So predictive, diagnostic, and prescriptive. So predictive is just the forecast of health events, predicting ISC demand, for instance. Diagnostic is identifying a condition. So it's more about interpreting the data, imaging, test results, ECGs, EEGs. And then last but not the least is prescriptive. So that recommends optimal actions by simulating outcomes of various decisions. So it basically means we are saying that the prescriptions that are given at the end when you have a diagnosis, so AI can actually help us to recommend those prescriptive optimal actions by simulating some of the outcomes based on diagnosis of in the previous stage. We have been talking about AI all the way until this slide. So the bread and butter of AI, machine learning, deep learning is, of course, the data. We don't have the data, we cannot run any of those algorithms, and AI will not be able to produce its magic. So the most important thing is to understand that when we talk about pandemic or epidemic crisis, where this data is going to come from, and what are the most important data sources that we have. So epidemiological data, genomic data, mobility, and social media data. So these four outlets of data represents the most important sources of data that we can gather to generate accurate insights during health crisis. So let's start with the epidemiological data. So that includes case counts. For example, how many cases have occurred in the last 24 hours of COVID-19? Transmission rates, hospitalization, mortality data. So World Health Organization, CDC, ECDC, American and European crisis management systems. These are the databases that exist, which are from this data source, epidemiological. The second data source is genomic data. So you might have heard that during the COVID-19 that there is another mutation of the virus and there is different COVID. So we started with one particular genome sequencing, and then it mutated, and then we have variants, first variant, second variant, third variant. So that is the genomic data. So there are different sources that are publicly available that you can use later if you are interested that what are those data and how we can use it for our epidemic and pandemic crisis management. Third, I think everybody has gone through this during COVID-19 is that the mobility data. We are moving, but we are carrying our smart devices, we are carrying our smart watches, we are using RFIDs, we are using tags. So aggregation of all those location data is important in order to understand the spread of the potential spread of the disease, or in order to monitor the population movement. So Google mobility reports, Apple Maps, metadata. There are many examples of the mobility data that exist around us, which were actually used by many countries during COVID-19 crisis management. The last but not the least is the social media and web data, because we have to understand that when there is pandemic and epidemic, the people are the ones that are most impacted, right? And the behavior of the people impacts lots of things, government policies, vaccine rollouts, and so on and so forth. So we need to understand the sentiment of the public. So real-time public sentiment can be obtained from various social media platforms like Facebook, like X, or previously what we call Twitter, and so on and so forth. So when all the data aggregates from social media, you can actually get the sense of what public is thinking about or what public sentiment is about a particular pandemic or epidemic, which will shape the policies, which will help understand the governments of the whole wide world if there are false information or misinformation spread in the public and how to circumvent that. All right, so we are on to the third part of today's presentation, which is AI application. So we have talked about why AI is necessary, number one. Number two, we talked about what are the fundamentals or AI foundations. Number three, we talked about how AI can be used in healthcare crisis and its management. And now we are talking about the applications of AI in healthcare. So first is early outbreak detection, which is very important for today's topic, that we are able to actually analyze the situation well before it actually happens. So AI-driven surveillance systems, basically. So they are able to detect infectious disease outbreaks earlier than the traditional public health methods. So if you remember the second and third slide where we talked about data aggregation and delays. So delay will will ensure we are not able to do early outbreak detection. So hence AI-driven surveillance systems are there to help us with that. I gave you an example of Blue Dot, which is an AI company in Canada. It runs big data analytics, and it flagged the Wuhan outbreak 9 days before the WHO alert, that is December 31, 2019, which gives you a very good idea of a real-time system that can actually predict an early outbreak before it happens. So if we have such systems, so you understand that our response, our preparedness for the pandemic and epidemic crisis management will be far better as compared to when we apply traditional public methods. Moreover, we can use NLP and ML, so NLP, natural language processing, and ML, machine learning, to analyze data from flights, from news, from animal disease reports, and social media that can help us for early outbreak detection. So there are other tools that are available which can combine geospatial analytics and real-time data mining to detect outbreaks. So there are multiple sources from which we gather the input. We have AI engines. Blue Dot is one of the examples I gave. So HealthMap, Metabiota, and ProMed, and there are others actually that you can use to do the AI algorithms, AI analytics, and AI-driven surveillance systems. And based on that, you will get an output where you can detect an early outbreak, or we can have early alerts for the whole wide world. And to the healthcare systems, we can detect hotspot maps, and we can do risk assessments to our economy, risk assessments to our societies, and risk assessment to our healthcare systems. Then the second application is predictive spread modeling. So we are going to talk about SEIR models. SEIR models are epidemiological models that are used to understand the spread of infectious diseases within a population. So it is basically a compartmental model, similar to the better-known model SIR that existed in the past. But it has an additional category to account for the exposed but not yet infectious individuals. By the way, I would like to know what SEIR means. So S is susceptible, means individuals who can catch the disease. E is exposed. It basically means individuals who have been infected but not yet infectious. I is infectious, self-explanatory, and R is for recovered or removed. So individuals who have recovered from the disease and now are immune, or unfortunately may have died, depending on the model which we are applying. So these SEIR models are useful for diseases that have a significant incubation period. So for instance, COVID-19, for instance, measles or influenza. So these models, if we don't apply machine learning, rely on statistic assumptions. This is the problem without AI. These static assumptions will not be able to provide real-life dynamic approach. If we don't have the real life and real-time dynamic approach, then the models that we train are not going to do well in a real setting. Because of these static assumptions, the traditional SEI models did not work according to our expectations. What we do in AI, we try to attach these SEIR models with ML or AI in general. So they become ML enhanced SEIR models, due to which what happens is that now we can say we are able to minimize the curve and the expectations of active cases versus the amount of stress that we have on the healthcare systems might reduce. So traditionally, SEI models, the difference between the expectations and the actual capacity of healthcare system is huge, because of which, of course, many people will not get treatment on time, mortality rate will increase, economies will destroy it, and so on and so forth. Then we talk about real-time risk assessment. Dashboarding is the most vital for such case. So real-time dashboards aggregate and visualize dynamic health, mobility, resource data to support rapid situational awareness. So it is basically a dashboard where you can have a look in a blink of an eye on all the important parameters that you would like to see. For example, what is the transmission rate of a particular disease? What is the mortality rate in the past 7 days or in past 1 month? What is the recovery rate in the last month? What is the recovery rate of a particular continent or a particular section of a country, and so on and so forth. So in a nutshell, a dashboard is something that can give you a situational awareness, and all the data that you need can be in one big screen, and that will help you to visualize it very easily. So to monitor the outbreaks, dashboard is the solution. Now, what we are saying is this dashboard is AI-enabled dashboard. So it's not that dashboards were not available before the AI era. They were, but they were not AI-enabled. So what we are saying is that AI enhances these dashboards by integrating multi-source real-time data, because if you know the traditional methods of crisis management is that there are delays and the systems are not on real-time data. Hence, AI will provide those real-time data and it will integrate multiple sources. So the integration of multiple sources will also provide scalability to the system and to the dashboard. And then running predictive analysis and so on and so forth, understanding geospatial mapping or hotspot identification remains exactly the same as we have discussed in the previous slides. Resource allocation, I think, is a big factor when we talk about any epidemic or a pandemic crisis. The reason is it impacts something that we call supply chain management, right? So what is, in a nutshell, for the audience, what is supply chain management? So supply chain management involves planning, sourcing, producing, and delivering goods and services efficiently. And when we say efficiently, so it means the right product reaches at the right time and at the right place with optimal cost. So just think about when we rolled out the COVID-19 vaccines. So supply chain management has had a big issue because the right product at the right time, at the right place with optimal cost might not be there. So in healthcare, this supply chain management covers medical equipments, PPEs, masks, gloves, medicines and vaccines, hospital supplies, and logistics and transportation. So AI can actually help us to optimize these logistics, inventory, by automating the supply chain management decision systems, recommending reallocation of strategies. For example, due to one bottleneck, the whole logistic is failing, then a recommendation of reallocation of strategies across regions, and so on and so forth. It will help manage the supply chain management system much, much better. And by the way, the supply chain management system since COVID-19 has not returned back to exact 100% even now. So you can understand the impact of such things in the long run as well. So diagnostics and screening. So this is something that many researchers are working on it, and it has become very, very important in healthcare that we use AI for detecting, testing, diagnostics, and screening. It can be used for chest X-rays, it could be used for CT scans, and so on and so forth. As I said previously, deep learning, machine learning models can be used on images to identify lung diseases, cancers, COVID-19 differentiation with respect to other types of pneumonia, and so forth, and so on and so forth. Then we talk about drugs and vaccine discovery. This is very important because AI accelerates drug discovery, because it's about, when you're making a drug, it's about different type of salts. So what should be the combination of salts or compounds, predicting drug virus interactions, molecular bindings, and other things. These are very important that we can do a lot of testing. We can waste a lot of time on doing that. But if AI is there, AI can accelerate this whole process, and the repurposing of the drugs or modeling of the drug virus interactions can be much faster. So during COVID-19, AI was used to identify promising repurposed drugs, and there are many suggestions given by AI-based simulations to support vaccine design, and so on and so forth. Public sentiment analysis. So NLP is the natural language processing, which can be used on social media, news, forums, lectures like this to gauge public sentiment in real time. So misinformation, conspiracy theories, vaccine hesitancy, fear, trust levels, because these are the things which are very important for governments to make decisions, and which are very important to make sure that there is a positive vibe if you are rolling out your vaccines in the public. So AI can help flag fake news. AI can help detect bot-generated content, and it can help authorities to adapt communication strategies according to the sentiments of the public and counter any false claims proactively. Contact tracing and mobility is very important, because we have the mobile smart devices which uses GPS, that uses Bluetooth. We have RFID cards, we have mobile sensor cards, we have sensors installed on our cars or bikes. All this can be used by AI to do contact tracing. So identify infectious hotspots, predict potential exposure chains, so that we can make policies based on this informed decisions. So Malaysia's my Sajetra, Singapore's Trace Together, South Korea's AI enhanced mobility tracking system are some of the examples of using AI enhanced contact tracing. All right, so we are on to the fourth part of today's lecture, which is integrating AI with decision making, which is one of the most important parts. This slide is very important, and as written at the bottom of this slide, that you are still the pilot. And by you, I mean humans are still the pilot. AI is only the co-pilot, so we are still in command. Of course, we can leverage the strengths of AI, but human strengths are there, which will ultimately decide how we proceed. So when it comes to AI, we can do pattern recognition. We can do things in without delays. So with speed, we can achieve scalability with AI, but ethics are governed by humans. Intuitions, empathy, the impact of decisions on the on public are the decisions in the larger interest of the public, and so on and so forth. So these are the human strengths. So if we combine the strengths of AI and we are able to make decisions in a much more informed way, in a much more speedy way, as compared to delays in the traditional systems, and combined with our own strengths, I think it becomes a very effective decision-making system. So AI augments human decision in healthcare and crisis response. So DSS, which is we call decision support system, it processes large-scale data and generating insights quickly. So collaboration with doctors, public health officials, logistic teams, technicians, nurses, even communication between different hospitals, different countries, different regions, all of this is very important for the decision support system. And again, AI is there to help us. We are the ones who have to make decisions. Policy and public health. So just related to the last slides, AI help governments predict outbreak trajectories based on real-time data analytics. They can inform public to the best of their understanding. They can launch vaccine campaigns with a positive note that public is going to respond positively to those vaccination campaigns, and AI dashboarding can be done to understand the epidemic or pandemic response on the larger scales. And one of the case studies that I would refer to, who is interested, please study about South Korea and Taiwan, how they use AI-enhanced data system for their pandemic response. There are a lot of insights provided in both these studies, which will help you understand how the policy and public health can be shaped by using AI-driven systems. Data visualization, so it's all about how transparent data can be presented and how easy the decisions can become. So turning AI predictions into actionable insights. So clear visualizations and faster interpretation of outbreak severity, spread patterns, future risk zones, and so on and so forth. So here I would like to give example of two dashboards. So one dashboard is GCI 19 by Pemandu, Mosti, and Sunway University Malaysia is also part of it. And the second is the John Hopkins dashboard. So the first example here on your screen is GCI 19 dashboard. So first of all, I did discuss this slightly before, but I would like to give you a little bit more information about what this dashboard basically means, or what dashboarding is. So it provides official and up-to-date information on COVID-19 cases, for instance, deaths, testing, vaccinations. Both dashboards, whether we talk about GCI 19 or we talk about Johns Hopkins universities, they track and understand COVID-19. So this Johns Hopkins one might be doing a specific region in the US. GCI 19 might be for the whole wide world. So these differences can exist between different type of dashboards, but ultimately they provide you the official and up-to-date information on the cases, mortality, death rates, testing, vaccination rollouts, the recovery index of the world, recovery index of the particular region, so on and so forth. So this dashboard can actually help you to visualize many statistics that you need in order to understand your response. Similarly is the case with Johns Hopkins University's COVID-19 dashboard. So coming to the later part of our presentation, but I think it's, as I said earlier, very important is to understand that while we talk about AI and we talk about how good AI can be in terms of presenting solutions and making systems, but ultimately it all comes down to what are the current challenges and limitations in deploying AI systems, and what we can actually do in order to circumvent and overcome these challenges and limitations. So let's discuss the challenges first. So, and I think 15 minutes ago, I was talking about that without data, there is nothing AI, machine learning, deep learning can do. So data quality is the most important thing if we want to develop a system based on AI. It could be any system based on AI, not just epidemic, pandemic response system, anything for healthcare, anything for engineering, computing, but incomplete, inconsistent, or biased data sets. There are many data sets that are available, but that will not do the job because AI needs quality data. So if we don't have quality data, quality can be measured in terms of completeness, can be measured in terms of consistency, can be measured in terms of biasness. So if we don't have this, then AI cannot predict effective solutions, cannot provide effective solutions. So common issues are missing entries, delayed reporting, inconsistent formats. You are collecting data in your country in a different way. I'm collecting in my country in a different way. So if we want to come together on a larger scale for scalability of the system, there will be lots of inconsistencies between my and your data that will have a significant impact on the AI models. Hence, this is one of the common issues. Then, are we representing each and every type part of population? If not, then it's a biased data set, and biased data set will not give you the results that you will expect in a real life situation. So low resource setting, you don't have enough resources to get the data. Biases in the training, again, as I said, biased data set is not going to help you develop an accurate AI model. So AI is only as good as the data it learns from. So model bias, so socioeconomic and geographic biases in AI outputs. I think even this slide is dependent on this last slide's this quotation that AI is only as good as the data it learns from. So if the data is biased, your model is biased. If your model is biased and it does not cover the socioeconomic and geographic biases, then skewed data sets will produce inaccurate or inaccurate AI models. So overrepresentation of data from high-income urban regions or overrepresentation from low-income rural regions, both can lead to underperforming models. And bias can affect disease spread models, hospital resource planning, vaccine rollout strategies, and so on and so forth. One of the biggest concerns nowadays in healthcare industry is ethical concerns, that hospitals have patients' data, how secure that data is, and how the data protection is going to be ensured in such systems. So a blockchain is one of the most important tools that have been investigated nowadays in order to protect the data, healthcare data specifically. So we need strong data governance frameworks. We need clear data retention and deletion policies. We need to review our ethic policy, regulatory oversight, because systems could be hacked. We need to ensure that technically the system is safe and sound, on the top of governance, on the top of ethics reviews and regulatory oversight. Scalability, so it's very important that the gaps in the infrastructure and low resource settings can be counted for. So power supply, digital healthcare infrastructure, it will vary from one region to the other region. So if you collect data from those, it will have a very different impact on the training of the AI model. AI systems trained on data-rich countries may not generalize to underserved areas. That's also very important to understand that every country will have different data collection strategy, which might be leading to a collection of low data or very high data. So we cannot generalize those models that are on either of these countries. So we need edge AI and lightweight, like TinyML models. We need better infrastructure in those areas where it is not. So infrastructure investment should be there, and so on and so forth. All right, so we are on to the last part of this presentation. So the challenges we have already seen. So what are some of the future directions that can be? So in this presentation, one of the things that I mentioned was that real-time data collection has been a struggle for traditional response system. So we need real-time data, real-time collection so that AI models can be trained appropriately. And our delays can be minimized and our responses can be timely, especially for epidemic and crisis management systems. So IoT, that is Internet of Things, is a very important tool that we can use in conjunction with AI to get real-time health monitoring. So we have smartwatches, everyone is connected to wireless networks, Wi-Fi. So can we introduce edge AI or cloud AI to actually do real-time health monitoring? So when we say edge AI basically means that rather than running AI on a central processing server, you can run AI on your mobile or on any edge device. If I give you a very simple example, is face recognition system that you use on your mobile. That is AI on the edge, because mobile device is an edge device. So if we try to use AI with IoT, so early intervention, remote patient management, population level disease surveillance, and pandemic response can be improved a lot. Then another thing that is being discussed quite heavily in 2024, 2025 is federated learning. So federated learning is different from conventional machine learning models. Models might be the same, but the way they learn is different. So federated learning allows models to be trained across decentralized data sources. So it's not centralized. It's not just one data set being trained centrally on one server. Rather, the AI models to be trained across decentralized data sources, different data sources without transferring raw data. So devices, for example, hospitals, clinics, smartphones, train local models and only share model updates, not patient data. So what it means is it will provide security. It will have a privacy preserving data sharing approach, that rather than saying that you want to train a model, this is the patient data, please train the model on this data. Rather than doing this, we train a model and share the updates of that model or share the trained model with you, not the data. So it preserves the privacy in that way. And you can always read the different privacy, security, personal protection policies, GDPR, HIPAA. So if you look at this diagram, so you can see that you need to have an aggregation server or where the models trained at 3 different locations can be aggregated. So as I was telling you earlier, in this case, what will happen is we are not going to share the data that this model is going to be trained or this second or third model. Rather, we are only going to share the trained model or the updates on those models where this server will aggregate the data and then you can use it for as a global model for prediction of diseases and so on and so forth for different applications of AI in healthcare. Digital twin is another important technology that can be used for healthcare systems. What is a digital twin? So literally, as the word says, twin, it's a virtual replica. It's a virtual replica of a real world system. So a population or healthcare system. What it does is it will help us to simulate many versions of how real life healthcare system will react in case of pandemics, for instance, which will help us gain insights on policy making and so on and so forth. So governments can test policies virtually before implementation because it's a digital twin. It's a virtual world, which is mimicking the real world. And we can apply different techniques to come up with different situations and how people are going to react in those situations, how the mortality rate is going to increase or decrease, how the healthcare system, how much it is going to be tested, is it going to be overwhelmed? All these things can be understood by having a digital twin. So government policies can be shaped quite accurately based on these digital twins. So as given in the third point, lockdowns, vaccination rollouts, travel restrictions, these can be decided based on the simulations that we run in a digital twin. Explainable AI. This is very important. So right now, one of the problems is that if I'm a doctor and I am not an AI expert, of course, then I am applying AI. So AI is a black box for me. I don't know why it is making a certain decision. I have to trust this blindly. So explainable AI is something that can provide more trust to the doctors. Explainable AI basically is something that will enhance the transparency. And how? That I don't know why the model is making a decision a certain way, but if explainable AI can actually show you why this decision is made and what are the circumstances based on which this decision is made, then it becomes more trustworthy. And that's why we call it explainable AI. And this explainable AI is actually very, very important in high risk applications. Healthcare is one of them. Finance is another. Defense is another. Hence, law is another. So explainable AI can be very, very important in order to provide and improve trust with AI. Then global collaboration, as I was talking earlier, that we need to have a system that is scalable. And scalability will come if there is data sharing. Governments share data, government, NGOs, tech, academia, they all come together to help each other to develop better public health ecosystems. And again, AI needs data, and if data sharing can be done in more preserved and secure way, then standardizing formats, protocols, ethics. Again, standardizing means across the whole continent or countries, we are using the same standard data so that if data moves from one country to the other for the purpose of making AI models, helping each other, it becomes easier. So collaboration between governments and stakeholders is very important. Open source AI tools, just like ChatGPT, is very important. So everybody can contribute. Everybody is able to see it transparent. And then infrastructure and data. Low resource countries with have less capacities, we can invest more in the infrastructure so that the public health ecosystems can be easier. All right, so let's come to the conclusion. So what are the key insights? We can use AI for detection, we can use AI for prediction, we can AI for mobility, but we need to understand ethics, we need to build trust, and of course, we need to have better policy. So AI can transform public health for early detection, real-time monitoring, and data-driven decisions. But we need to ensure data is there. So data availability, infrastructure gap, ethical implementations are still limited. We need to work on that. We need to make sure, as I said, natural language processing, Internet of Things, digital twins, these are the technologies we work together and make sure that faster outbreak response is there. And again, it should be emphasized, AI is to help, AI is not to make decisions. We have to make decisions, but we need to make sure AI is being used in the right manner. So then going into the future, I would like to say that in the past, how we used to use AI. So it was more about detection and tracking. Right now, we are thinking more into ethical integration, that sharing of information, privacy of information. So the focus is to privacy, ethics, and human in the loop decision making via federated and explainable AI that I just suggested for future recommendations. But what we are looking in the future is a future resilient ecosystem. So we are thinking about sustainability, so that global collaboration, digital twins, and alignment with SDGs are the way to go, that pave the way for AI-driven, equitable health systems. A very important quotation, that AI is not a silver bullet, but when aligned with human judgment and global cooperation, it becomes a powerful tool for saving lives. So thank you very much, everyone, for listening to me patiently. And thank you very much for, again, AI4PEP for giving me this opportunity for this lecture. So I'm more than happy to connect with you via email or LinkedIn, and I will be happy if you wish to do any collaboration work or you wish to understand this topic more. Thank you very much.
Thank you so much, Dr. Saad, for that amazing presentation. I really appreciated how in-depth you went, not only on the justification for why we need AI, but how it can be implemented, and then the challenges we face and how we can navigate those challenges. So we'll be opening it up for a short Q&A period, in case anyone in the audience has questions. But really, thank you so much, Dr. Saad. That was amazing. So go ahead if there's any questions from the audience. Amna, you have a question? Feel free to unmute.
Hi, thank you so much. Yes, I have a question from Dr. Saad. First of all, thank you so much for the wonderful presentation on the AI and the use for the crisis management and resilience, like all that. So I just want to know that if somebody is doing qualitative research, so how can the machine learning models can be used for for judging the resilience in the supply chains, like you have told about the healthcare sector or maybe other sectors? So how a qualitative data set can be utilized into that machine learning model?
Okay, so thank you very much, Dr. Amna, for your question. So first of all, I think AI can be used irrespective of what kind of research you are doing, if that application is meant for it. Given that you asked me a question regarding supply chain management, so I can say confidently, yes, supply chain management has a very big application for AI. So whether we talk about qualitative research or quantitative research, irrespective of the field, AI can still be used. So what you have to do is, when you talk about even a qualitative or quantitative, you have to select the right AI models that can be implemented for the given solution. And one of the important things is to understand what you are looking to obtain from the AI model. So I can give you a more detailed answer if you can share a particular problem, because AI is very, very subjective to a problem. And when I say AI is very, very subjective to a problem, it basically means we have to understand what type of data set we are dealing with, irrespective of where it's qualitative or quantitative research. It's a number, it's a text, it's a signal, it's a ECG, it's so on and so forth. It's a Excel sheet of entries for supply chain management. And what we want to achieve, is it a problem of logistic regression? Is it a problem of classification? Based on that, we can actually understand what type of algorithm can be used. So I can provide more details if I understand the exact nature of the problem.
Thank you so much, Dr. Saad. For example, let's take a scenario, for example, like, different crises for the healthcare sector, like, flooding is there, lockdowns are there, as you just mentioned about it, and, political issues could be there. And people are expressing their, patients are actually expressing their views about it, that how they can access the, healthcare facilities. And they are just giving you some narrative statements of their different feelings. So can we use that particular, data set of based on the participants, observations in different types of crisis, and utilize any machine learning models to predict that how we can handle or we can overcome this issue?
Definitely, definitely. That is, so in my presentation, one of the pillars from which we gather data is the social media. And one of the things that is very important is that in any natural disaster or pandemic, epidemic crisis management, uh, one of the most important thing is to understand sentiment analysis. So natural language processing, ChatGPT or DeepSeek is one of the biggest examples. So natural language processing can be applied to the case that you are mentioning, Dr. Amna, and based on that, you can actually shape the policies that or the government can shape policies, and it can be nationwide. It can be dependent on certain areas. So yes, natural language processing is the answer to the problem that you just raised.
Thank you so much. I think I've got the answer. Thank you so much.
Thank you so much for that question and for your answer, Dr. Saad. Do we have any, oops, sorry. Do we have any other questions from the audience? If not, I actually have a quick question for you, Dr. Saad. So you talked about how data acts as, oh, can you hear me all right? Yes, okay.
Yes.
Got worried for a second. But you talked about how data is kind of the bread and butter for AI, and how AI can only be as good as the data that we have access to that we can feed to it. So I was wondering if you had any insights or thoughts on how we can navigate challenges around data access in underserved countries or regions that might not have the same localized data sets, like what it would be their approaches or best strategies for navigating those data access challenges and still being able to build robust models.
Very important and very good question. I think in order to make sure that we can achieve just what you asked, we need global collaboration on that. So tackling pandemics or health crises or making sure that we have the correct data, we need cross-border AI collaboration and data sharing. One of the most important things in such cases is standardizing the data formats, protocols, and ethics in order to make sure that this is operational. So collaboration between governments, collaboration between academia. This project is a great example of that. So we are having so many countries that are under AI4PEP. So this is a collaboration between academia, tech industry, and global health bodies. So promoting open source AI tools, promoting shared data sets, and best practices for scalable deployment. So, for example, you talk about low resource countries, right? Low income countries. So strengthening low resource, low income countries, low resource country capacities with shared infrastructure and training and AI literacy programs. That global collaboration can only answer this question. So standardizing data formats, collaboration between governments, academia, tech industry, and promoting open source AI tools, shared data sets, practices, and strengthening low resource countries' capacities with shared infrastructure, training, and AI literacy programs. These are the 4 points that I will suggest for your answer.
Thank you so much.
Please, I have a question.
Go right ahead.
All right, thank you. Please, you said we could use AI for tracking, in the sense that we could identify hotspots for infectious diseases, and you show us in your slide where we saw some humans. In a disease such as the zoonotic diseases, can we identify animals with infections using AI?
Okay. Yes. The answer is yes. And these kind of research is already available. So if you go and do some literature review, you will understand that there are IOMT, Internet of Medical Things, and they can be used. So you have sensors. I'm just giving you one example. You have some sensors deployed on animals. So you even have gait analysis of different animals to understand if they are healthy or not, and so on and so forth. So yes, this can be applied. IOMT is one of the biggest technologies that are used to make use of AI and IoT to identify diseases in animals.
I mean, diseases in animals that can infect humans, for example, the monkeypox. Okay.
Yes,
Thank you.
yes, definitely.
Okay.
So when I was talking about IoT, basically IoT refers to the interconnected network of medical devices and applications that connect to the internet and transmit data. So if there is transferable disease in the animals, this IoT network can actually IoT network can help you on your dashboard detect if it is transferable or not. And you can do lots of simulations by using digital twins to understand that if this disease goes into the public, then how fastly it will propagate and how fastly it will become infectious. So yes.
Okay. Thank you, sir.
No problem.
Okay, I see a hand raised and I also see some questions in the chat. So we can start with the hand that's raised and then I'll read out the questions from the chat. So Manjar, feel free to share. Manjar, are you there? If you're unable to mute, you can drop the question in the chat.
Yes, hello, I'm there.
Yes, go ahead.
Okay, thank you, Dr. Saad. My question is, can we use this AI application to detect fake news?
Sorry,
Is there
there
any
was quite
application
a
we
lot
can
of
use
break.
to detect fake news?
Yes, yes.
Okay, let me come again. I was asking
Yes.
if there
I
are,
think I've
if
got
there
your
are,
question.
if there are applications, if there are applications, AI applications that can be used. Okay.
Yes, yes, I got your question. Thank you very much. So AI is actually already being used to detect fake news. So sentiment analysis is one of the fields that under which fake news detection is one of them. So the big powerhouses of media like BBC and others, and many others are already using these technologies. So the spread of misinformation, AI can play a pivotal role in verifying news and combating disinformation. I can give you one example. For instance, if a news is generated by a bot and not by a human, and the news generated by a bot is fake, then AI can actually detect that bot has generated this news, and which can indicate fake news. I'm just giving an example. So yes, it can be used. So again, just like I answered Dr. Amna about the sentiment analysis, this is again an example of sentiment analysis. So AI can leverage NLP, natural language processing, to analyze and cross-check the content. So these NLP algorithms, natural language processing algorithm, can detect patterns and indicators of misinformation. They can examine text structure, they can examine semantics, and also the source of information. An AI system can also do cross-referencing the data with reliable databases and trusted sources to validate facts presented in the news. So yes, this can be done.
All right. I'll do maybe 2 or 3 questions in the chat if there's time, and then we can wrap up from there. So one question that keeps showing up is, what if AI predicts and predicts wrongly? So what happens if AI makes a mistake?
Yes, a very important question. You see, in my presentation slides, I mentioned one thing, that we are the ones who are the pilots and running the show, not the AI. AI is only to help us make decisions. So in order to be confident about AI, first of all, we have to make sure that the training is done properly. The training is done on an unbiased data. The training reveals results. And then before we actually deploy an AI system in a real life, we test it quite rigorously. And we go through it through many rounds of testing to ensure that it runs smoothly and it performs according to our expectations. The second thing is we are nowadays working a lot in moving towards explainable AI. That rather than thinking that AI is just a black box and whatever comes out, we just believe it or trust it, we actually have a concept called explainable AI, where we think about that why a certain decision is made under circumstances. So that will increase our trust on AI. So testing plus enabling explainable AI is the answer to this. Yeah.
Thank you. I see Dr. Tuya has their hand raised if you'd like to ask a question. Dr. Tuya, are you there? If not, then I'll move to a question from the chat.
Okay. Thank you so much for your very nice presentation. So my question is about to mistake of AI. So example, what is your opinion about AI models evaluations, especially for accuracy? So because there is a difference between traditional models and AI models, but just about the accuracy of any type of AI models important. So if we made mistake, maybe it belong to the accuracy of the evaluation method. So what is your opinion about this task? So did you catch my question?
So what I understand is that you're asking what if we are just focusing on AI accuracy, and even then it makes mistakes, then what? Is that correct?
Yes, exactly.
All right. Okay, so first let me tell you why accuracy is important. So when an AI system gives inaccurate answers or make mistakes, it violates our trust. I understand that. So whether in education or healthcare or any other domain. So we have to understand one thing, that the data quality that I've been referring to presents many important questions. So AI learns from the data. So if the data it's trained on is incomplete, biased, or not representative of the actual facts, the AI will make correct predictions or answers. In that case, if you don't have a quality data, even if you say your AI system is showing an accuracy of 100%, it might not be good in a real life system. So imagine, teaching us. Let me give you an example of in education. You imagine teaching a student who only have studied one part of a subject and not the entire curriculum. And chances are they will make mistakes if they are questioned about the other parts that they have not learned. Correct? So this is what, but now if you say, but my model was 100%, but that model was 100% just based on one part of a subject. But you are testing that model to other parts of the subject that was never taught to the student. So student will never be able to reply. Same is the case with AI. If you want to trust AI, two things have to be there. One is the quality of data. if you are applying data for one particular application, you have to ensure before you start modeling or before you start training your AI model that the data quality is unbelievably high. There is no misrepresentation, there is no bias, there is no incompleteness, there is not too much of augmentation, it is not underrepresentative of something, then you can expect AI to produce those solutions that you require. And one of the examples of that would be that sometimes what happens is that if you are running an AI algorithm on a specific data set, it produces answers very accurately. But the moment you change the data set a little bit, the accuracy drops, say, from 100% to 70%, because it has never been exposed to that data and it has been overfitted to the old data set. So, in other words, what I'm trying to say is the data quality is something that has to be accurate in order to make sure you do get the desired results. Otherwise, even 100% accuracy of 100% does not make any sense. Yeah. So
Thank you so much.
if the AI model is underfitted, if the AI model is overfitted, in both cases, it will not give you the correct results, even if it is 100% accurate.
Okay. Thank you. Thank you for your answer. Thank you.
Thank you so much. I think I'll do one more question from the chat and then we'll have to wrap up for time. But someone asked, how can public manipulation be mitigated, especially with persons having fears of being replaced with AI? So this is more about ethics of AI as a whole and the role of humans, like how it can affect the workforce. If you have any thoughts on that.
Let me read the question, please, if you don't mind.
Sure. So it's the last question in the chat. How can public manipulation be mitigated, especially with persons having fears of being replaced with AI?
Okay, so this is from Noela, right?
From Agbor. It's at the bottom.
Okay, so third last. How public manipulation to be mitigated, especially with people fearing? So the most important thing is that public manipulation, I think, refers to unethical practices. Like, is that correct? Data fabrication or image duplication or plagiarism. Is that correct? Because it depends. The answer depends on what kind of manipulation you are referring to.
Yeah, it's not super clear. I'm not sure if they're there to unmute and clarify, but if not, I guess we can assume it's more about like unethical practices. Yeah.
I mean, based on what I understand, I can answer just quickly so that at least that question does not remain unanswered. So if it is about public manipulation, so unethical practices like data fabrication or plagiarism or ghostwriting or selective reporting, fortunately, AI can help mitigate these manipulations in several ways by automating and enhancing the processes of detection, verification, and accountability. So AI-powered data fabrication and manipulation, how to detect image manipulation, how to detect ghostwriting and authorship issues, AI for citation manipulation detection, even monitoring, auditing research publications, bias detection in research. All of this can be done by AI if that was the question. Okay, yeah, thanks.
Okay, thank you so much, Dr. Saad, for your amazing presentation and for the great answers you gave. And thank you to our audience for the great questions you've been giving. I saw one question that I'd like to clarify about sharing the slides. So we will make this recording available and we can send it out by email to all participants. So you'll be able to access the full presentation. So with that, I think we will, move on and have to come to a close. But thank you so much, everyone, for joining us. Thank you again, Dr. Saad. Your presentation was amazing, and it really clearly engaged people a lot because we got some excellent questions and excellent answers from you. So thank you so much for your time, and for your knowledge and expertise. So quickly, I'll just say, okay, there's a question about how we can connect with you, so we can wrap on that. So what is the best way to stay in touch with you, Dr. Saad?
Yeah, thank you. I will be, so if there are any questions that remain unanswered and you would like to connect with me, I will be more than happy to answer any questions that you may have. So you can either email me, that was the last page of my presentation. So either you can email me or you can connect me on LinkedIn. I showed my handle or LinkedIn handle on my last slide. You can connect me there. You can throw messages to me on LinkedIn. I will be happy to answer. So either email or LinkedIn, no problem.
Thank you so much. And if you don't mind dropping that in the chat if you have the chance. But
Sure.
thank you again. And I think with that, we can wrap up there. So if you're interested in staying connected with AI4PEP as a network, feel free to scan the QR code on the screen. It'll show our newsletter, our lecture series, past events, if you want to watch our previous lectures, and other ways you can stay in touch with us. And you can also connect with us through our socials, which are in the corner in the bottom left. So thank you so much again to everyone for joining us today. Thank you, Dr. Saad, for your amazing presentation once again. And I think we can call it a night. So thank you so much for all of your time. Have a great day.
Thank you.
Everyone.
Thank you. Bye, everyone.